Hey guys, quick note on respiratory syncytial virus, RSV. This is one of the three big viruses we see in respiratory viral season. This virus disproportionately affects infants, so babies under the age of 1. In fact, most of us will have had this virus by the age of 2, but some babies will get sick from it. They'll get things like bronchiolitis or pneumonia. It's the second leading cause of infant death around the world. So what can we do to protect babies? So within the last year, there have been two new and really exciting ways that we can actually protect babies from RSV. The first is actually what's called a monoclonal antibody, so a synthetically produced antibody against RSV called nirsevimab, which we can actually give to babies in the first few weeks of life, or even in the first year of life before they enter their first RSV season. And this study shows that this is actually quite effective. There's about an 83% efficacy at reducing lower respiratory tract infection with RSV. But a lot of people out there don't like medications, particularly giving a medication or a synthetic product to a very young baby. They like natural things. And so the other solution is actually a natural way to protect those very young babies. And that is to give a vaccine to the pregnant woman before the baby is even born. What that vaccine does is it elicits that immune response in the pregnant woman. She gets protection, so you get a 2-for-1, but those antibodies also get passed through the placenta to the baby. So the baby is born with those natural mother's antibodies on board. And in that very vulnerable, the most vulnerable part of life, which is immediately after birth, in those first few months after birth, they are protected by mother's antibodies. And it works very well. This study showed that if you vaccinated the mother late in pregnancy, the baby had, in the first 3 months of life, an 82% protection against severe RSV. So if you're pregnant or thinking about getting pregnant and the baby is going to be born in RSV season, talk to your doctor about getting the RSV vaccine during pregnancy to protect your baby, and that is a natural way to protect your baby with your own antibodies.